I left Georgia for Denmark in 2000. I went through all necessary licensing stages and soon I received a license of oncologist. Now I work in Copenhagen University Hospital, which is the largest hospital in Denmark. I am head of oncology department. Once a week we hold conferences where we discuss all patients, their treatment plans and control schemes, where we meet the patients personally. All patients are treated according to the latest standards. Our purpose is to bring here all modern methods, introduce them in EVEX, and apply in treatment of our patients.
I left Georgia in the 90s. For about 22 years, I live in Holland. I believe it was a right choice. When you arrive in Europe, nobody is waiting for you. Nobody tells you, come here and I'll create favorable conditions for you. You have to achieve everything through diligent work and struggle. But it needs much effort. I've been working in LabPon for 7 years already. It's one of the largest and successful laboratories for pathology in Holland. Our laboratory is the first lab in the world in digital diagnostics, and I'm very proud of it. Pathological anatomy is a very important component of diagnostics and treatment in oncology. We, pathologists, make very significant diagnoses. Moreover, we give advice for treatment. We can study a sensitivity of tumor, define medication, and other ways of treatment. There's a laboratory for pathology in our Kutaisi Oncology Center. In some cases, when there's uncertainty in the diagnosis, or some material is sent to me for consultation, I and my colleagues in Europe review this material and express our opinion, or discuss the ways for coping with these problems. A field of pathological anatomy plays a very significant role in treatment of oncological diseases. When I study the material and find out that it's non-malignant, I'm always happy to give the patient good information.
For 6 years, I worked as a chief onco-hematologist in Ham Oncology Hospital of Evangelical Church in West Germany. Ham Oncology Hospital is one of the largest oncology centers in Germany. I was managing pharmacological therapy of the patients with onco-hematological as well as solid tumors. Besides, I was carrying out bone autologous transplantation. After returning to Georgia, I became head of hematology oncology department at EVEX Medical Corporation. Today, all the oncological patients which enter out of network are managed jointly by the oncologists who work abroad. In Kutaisi Oncology Center, we have all capacity to manage patients in accordance with modern protocols. We all are involved in every stage of disease. In oncology, it is also very important to manage side effects. We study every patient individually and define probability of complications at various stages of the disease, according to predetermined factors. We do our best to prevent undesirable side effects, to promote a good outcome of the disease.
For the first time, I left Georgia in 1991 when the Soviet Union started to break up. Then there occurred an opportunity to take a postgraduate course. I phoned to Chicago, USA, Illinois Institute of Technology, where I defended a dissertation. For 8 years, I work at Northwestern Memorial Hospital as a medical physicist. Medical physics is the only field of medicine where a doctor and a physics work with patients jointly. A medical physics is responsible for a safe treatment of the patient. It means that the equipment should operate properly. Beam parameters should not deviate from the parameters which we set in the planning system. We work out a plan so that the tumor receives required dose, which is provided by the plan, and it's always verified by a physicist before treatment of the patient. We connect through Skype from Chicago with every new patient who starts treatment, discuss the patient's treatment plans. We are lucky to have such a good team at Kutaisi. They work diligently and understand that a patient is number one concern.
I have 40 years of experience working as a radiation oncologist in the United States. Besides, I'm a member of the American Team of Radiologists, which supports the U.S. government in the introduction of new oncological radiological protocols. As a professor, I am involved in the educational process and teach students at the medical department radiation oncology. I have cooperated with the Oncology Center of West Georgia since 2015. I have to visit Kutaisi several times per year, where I make on-site assessments of the clinical work conducted by the local team of physicians and radiologists. I meet personally with the patients who have taken courses of radiation therapy. When I am not in Georgia, I have to conduct remote daily work with my colleagues from Kutaisi. I participate in the planning of treatment for every primary patient. According to supplied studies, I define the total dose of radiation for the patient and the area which is to be treated. There are 2 of the latest linear accelerators in Kutaisi, which have advanced therapeutic capabilities.